Physical therapy after knee replacement isn't just recommended, it's absolutely crucial for recovery. In this video, I'll walk you through 5 of the most important exercises you can do at home in your first 2 weeks after knee replacement, including why they're important in the first place and the common mistakes to avoid. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a board-certified orthopedic surgeon. After residency, I completed fellowship training at Harvard Medical School specifically for hip and knee replacements. One thing I've seen time and time again is that patients who get an early start in physical therapy also tend to have the smoothest recoveries. These exercises are used very frequently, but like with any exercise program, check with your medical team first. Let's start with the easiest but still crucial exercise, ankle pumps. This is something you should be doing from day one, even while you're still in the hospital. To perform ankle pumps, lie on your back with your legs straight or slightly elevated. Move your foot up and down rhythmically, as if you're pressing and releasing a gas pedal. Pull your toes toward you to contract your shin muscles, then point your toes away to contract your calf muscles. You can also make gentle circles with your ankle to engage movement in all directions. Ankle pumps are crucial because they activate your calf muscles, which function like a pump in your leg to boost circulation and reduce the risk of blood clots. Blood clots are one of the most serious complications after knee replacement, so this isn't just about comfort, it's also about safety. Ankle pumps also reduce swelling in your leg and foot, which makes it easier to bend your knee and perform other exercises. Don't just barely move your foot. You need to move through a full range to properly engage the muscles. Avoid holding your breath or tensing your whole leg. Another common mistake is only exercising the side you had surgery on. Pump both feet to promote balanced circulation. After all, blood clots can happen on the non-surgical side as well. Do ankle pumps very frequently, at least 10 to 20 times per hour while you're awake in the first few days after surgery. This might seem like a lot, but they're pretty easy to do, and they're that important for preventing complications. The second exercise is quad sets, which focus on waking up your quadriceps, one of the most important muscles for healthy knee function. To perform quad sets, lie flat on your back with your leg extended. Tighten the quadriceps muscle on the front of your thigh, as if you're pushing the back of your knee down into the bed. You should feel your knee straighten and your thigh muscle firm up. Hold this contraction for 5 to 10 seconds, then fully relax. Make sure to completely relax between repetitions. Your quadriceps muscle is often shut off right after surgery, due to a combination of the surgical trauma, swelling, and pain. Quad sets help to reactivate this extremely important muscle, which helps prevent your knee from giving out on you while you stand or walk. A common mistake is to just think you're tightening the muscle when you actually aren't. Ideally, you may be able to see and feel it firm up. Avoid holding your breath during the contraction. Don't use other muscles like your glutes to help. Your effort should come entirely from your thigh. Make sure you're fully relaxing between the contractions, which allows for a stronger contraction the next time. Do quad sets frequently throughout the day, typically 10 repetitions every hour or two while you're awake. You want to accumulate many contractions throughout the day to help the muscle get back on track. Let's move on to knee extension stretches. This helps prevent one of the more common problems after a knee replacement, which is a knee that won't straighten completely. Lie flat and place a blanket or a pillow under your foot, elevating your heel. Make sure that your knee itself is unsupported. The goal is to allow gravity to gently pull your knee toward full extension. You should feel a moderate stretch or some tension in the back of the knee. Work toward holding this position for 5 to 10 minutes at a time if you can. Regaining knee extension, which is your ability to straighten your knee, is just as important as regaining your ability to bend your knee. The biggest mistake is resting with a pillow under your knee all the time. While it might feel comfortable, your knee can get stiff in this position, and it can be difficult to regain full extension. You don't have to force your knee down with heavy weights right after surgery. A gentle, sustained stretch is usually effective enough. If you experience significant pain or numbness and tingling in your foot, then take a break from stretching. Do this stretch multiple times daily, typically at least 3 times, holding 5 to 10 minutes if you can. Even when you aren't actively stretching, be mindful of trying to keep your knee as straight as you can when you're resting. Next up is heel slides, which helps you regain knee flexion, or the ability to bend the knee. To perform heel slides, lie on your back and slowly bend your knee by sliding your heel toward your buttocks while keeping your heel in contact with the bed or surface that you're lying on. Go until you feel a comfortable stretch. You might not be able to get very far initially, and that's perfectly normal. Hold the bent position for about 5 seconds if you can, then slide your heel back to straighten the leg. Keep your kneecap pointed toward the ceiling throughout the movement. Bending your knee is crucial for sitting in chairs, putting socks and shoes on, climbing stairs, and several other activities. Swelling and pain may limit your flexion early on, but doing heel slides helps improve your knee's mobility. Without working on knee flexion early, you run the risk of developing knee stiffness, and that might need more aggressive treatment later on. Don't be too aggressive and try to force a deep bend too soon. This can actually aggravate the inflammation and set you back. However, you don't want to be so cautious that you avoid any discomfort. Tolerable levels of discomfort are totally normal and very necessary for progress. Keep your heel down on the surface throughout the movement, and don't let your leg rotate outward. Aim for several sessions throughout the day, at least 3 sessions with 10 repetitions each. You can also do a few gentle bends when you're lying down throughout the day. Consistency is probably more important than intensity in the early weeks. We'll finish with one of the more challenging exercises on the list, the straight leg raise. To perform straight leg raises, lie on your back with your non-surgical knee either straight or bent slightly to support your back. Keep your operative leg straight, and first do a quad set to tighten your thigh. Then, slowly lift your straight leg until your foot is about 12 inches off the bed. Hold this position for about 3 to 5 seconds if you can, then slowly lower the leg back down. If this is too difficult initially, continue working on quad sets and try again in the future. Being able to lift your leg with your knee straight is a key milestone that shows that your quadriceps is recovering properly. This strength is crucial for standing, walking, and virtually any activity that involves your leg. The exercise also engages your hip and core muscles, which helps to improve your overall stability. The most common mistake is letting your knee bend when you lift the leg. This is usually because the quadriceps isn't strong enough yet, and we call this an extensor lag. If your knee bends, lower your leg back down and try again with a stronger quadriceps contraction. Don't use momentum or swing your leg up. Avoid arching your lower back, and consider bending your other knee to keep your back comfortable. In the first 2 weeks, do straight leg raises as tolerated, typically 1 to 3 sessions a day if you're able to do them. Start with just a few repetitions and build your way up to 10 per set. Early on, quality is much more important than quantity. These 5 exercises work together as a system. Ankle pumps reduce the risk of blood clots and swelling. Quad sets wake up one of the most important muscles around the knee. Extension stretches improve your knee's ability to straighten. Heel slides restore its ability to bend. And straight leg raises further rebuild the strength of your knee and core. Patients who stay consistent with these exercises in the first 2 weeks set themselves up for the best possible recovery. Start with what you can do comfortably and progress gradually. Remember, some discomfort is usually normal, but significant pain means you should stop and check with your surgical team. If you recently had your knee replaced, you probably know how challenging sleep can be early on. If you'd like to know how to improve your sleep during your knee replacement recovery, I'll link my video on that right here. If you found this video helpful, click the like button so I know to make similar videos, and leave me a comment down below on what I should cover in the future. Stay well, and I'll see you in the next video.